In early November, the FDA issued an emergency use authorization for an investigational monoclonal antibody therapy for the treatment of mild to moderate COVID-19 in adults and pediatric patients. Well, since December, Backus Hospital has been administering the treatment and is about to mark a very impressive milestone. Here to discuss this is Dr. Kyle McClaine, Chief of Emergency Services and EMS Medical Director at Backus Hospital. Doctor, welcome.
Hi, thank you for having me.
So tell us about the treatment.
Sure. Bamlanivimab, or BAM for short, is essentially an antibody against COVID-19. In normal process in the human body, we have these special immune cells called lymphocytes that sample something foreign and make antibodies against it. The antibodies then bind to the foreign invading organism and inactivate it by not letting it replicate or spread in the human body. So BAM is one of these antibodies, only it's produced in a laboratory. This type of therapy is not new. It's used for many conditions presently, including cancers, immune diseases like rheumatoid arthritis and Crohn's disease, osteoporosis, and even for reversing certain toxicities of drugs like digoxin. In the case of BAM, the FDA approved emergency use authorization for this medication because it's an older idea but a new application.
Wow, very interesting. So how many have been performed at Backus and who is a candidate?
So Backus just reached its 100th patient this past week, and Hartford Healthcare in total has infused over 400 patients. In the East region of Hartford Healthcare, we just additionally started offering this treatment at Wyndham Hospital as well.
All right.
Candidates...
sorry. Tell us about the infusion process. How long does it take?
Yeah, so candidates for the therapy have to be in their first 10 days of their COVID-19 infection. They can't be sick enough to be hospitalized. There are more appropriate therapy combinations for hospitalized patients. And patients have to have certain conditions. They have to be either over 65 years of age or those even over age 12, younger patients who have medical conditions like heart or respiratory disease, diabetes, asthma, CHF, COPD, cancer patients, transplant patients, people with Parkinson's, high blood pressure, and very importantly also those who are overweight with a body mass index over 35. That's a high-risk population.
All right, doctor, quick final question. Tell us about the results from this therapy.
We're seeing really good results from the therapy so far. We've had very, very few patients need admission to the hospital after receiving this therapy. Those that do are frequently ones that come to their infusion and they're already quite sick. So it's important to get in before day 10 and before the infection is really advanced. Otherwise, it's a one-time visit. People get in and out pretty quickly. It's less than 2 hours, and it's very easy to obtain.
All right, Dr. Kyle McClaine with Backus Hospital. Thank you so much for joining us.
Thank you for having me.
Thank you.